Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, in the glaucoma, what are the clinical features of glaucoma? So, in the clinical features of glaucoma, a patient with glaucoma will present with photophobia, blepharospasm, and there will be lacrimation will be seen. There is presence of big cornea called as ophthalmos. Corneal enlargement will be seen more than 13 millimeters of 13 millimeters, and there will be breaks in the descendants membrane. In the descendants membrane there will be breaks which are called as Habs striae, where you see breaks in the descendants membrane. Then there is blue corneal edema will be seen, along with the blue and thin sclera is seen in the child with deep anterior chamber, and flat lens are also seen. There is deep anterior chamber and flat lens is seen, which may subluxate. Intraocular pressure is obviously raised, and there is enlarged cup disc ratio is present. So if you see, there is here we can see that there is blue cornea is seen here with ophthalmos, that is eyes are very bigger eyes, enlarged eyes, bull shaped eyes are seen, bull like eyes are seen. A corneal enlargement is also seen. See, the cornea is very big, and there are these lines are called as Descemet's lines. No, sorry, the Habs striae are seen, which are the lines over the Descemet's membrane.
thank you and thank you for watching.